Okay, so you asked me right before we went on the radio this morning, you said, did you see Louisiana Senator John Kennedy on the floor of the Senate yesterday?
Oh, he was really engaging.
And we are efforting to track a little bit of that sound bite down. What did he say? What was it?
It was interesting.
I assume this was healthcare related.
Yeah, absolutely. And it was interesting because Senator Cassidy was acting as Senate chairman. So he was up on he had the gavel, he was up at the big chair. And so he got up and he said, Mr. President, as a doctor, he kind of made reference to his buddy. Then he brought out some numbers that John doesn't usually do. He gave some numbers and he honed in on just Louisiana. He said, in Louisiana, we now are limited to 3 exchanges. That's all the choices we have.
And there's a lot of states that are limited to one.
Yes. One only.
Now, why do you think that is?
Because
we're talking about Obamacare exchanges.
Yes, the Obamacare exchanges, because they're going broke.
Because they're losing money.
Yes.
At Obamacare.
They're hemorrhaging.
Remember, and I said this all this week, every day this week, it's not health care. It's welfare. I was just watching on the TV here in the room. And it's this big Democrat celebration because the bill to even discuss repealing or changing Obamacare was met with defeat yesterday.
Yes.
Primarily because of John McCain, Lisa Murkowski, and Susan Collins. This is the amazing part. Susan Collins, co-author of an Obamacare replacement bill with Senator Cassidy, has now voted against even discussing, debating a repeal of Obamacare.
Yep, that was early this morning. It's tough.
So please continue.
He got some number, and one of these was right at you, so I'm going to save that for last. But he got up and he said, and in my state, Louisiana, 130,000 people have decided they would rather pay the fine than sign up for health care.
Well, why wouldn't they?
Because it costs them too much money.
Well,
and he said, let me give you the example.
Originally, the first couple of years, the fine was $325. Then it exploded, skyrocketed to $625.
Yep.
Then when it got to be a couple of $1,000s, President Obama said he told the IRS, don't enforce the fine. So what was the motivation? If you understand that Obamacare was built on young people who don't use health care, healthy people signing up and paying for people who do. When you waive the penalty, the punitive measure to make them be part of the system, you are destined to fail. Now, I know you've heard this 1,000 times and you have dismissed it because it sounds too, in your mind, tin-foil hat conspiracy. But you've heard people say the original purpose of Obamacare was to fail, was to implode, was to destroy the private healthcare system, i.e. the insurance companies.
And the government control it all.
When you have a government-controlled system, what did I say before? The diabolical genius of healthcare in this country is that we are running an entitlement program, a welfare program, funneling it through private enterprise, i.e. insurance companies. But if you cause those companies to go broke, but understand, when people say the original point of Obamacare was to fail, was to destroy private insurance so that the government had to rush in and take over. Thank God for Democrats. Thank God for Barack Obama. Thank God for Hillary Clinton. One little problem. They never saw Donald Trump coming.
Yeah.
But does it seem that outrageous to you now when you rethink that the purpose was for Obamacare to fail? Because you know what? It's failing. Why else would they waive the fine? Please continue.
Absolutely. Then he gave the example of a 60-year-old man who pays in the neighborhood of $400 a month for his insurance, and then his deductible is another $4,000. He said this man is paying $9,000 a year for health care. And many of them can't afford it. And what do they get for that? He went on to say 4 doctor visits, 3 prescription medications. It was some really crazy things.
Pardon me again. Hang on just a second.
I'm so unfamiliar with all the minutia. It was so good to hear.
Pardon me again. Hang on for just a second. Healthcare in this country, the debate that's going on right now is not about this 60-year-old guy. And it's not about you.
No.
And it's not about me.
It's about Matty Poo.
It's not even about Matt. It's about people who don't pay. pay.
130,000 in Louisiana.
It's about people
are not insured. They would rather pay the fine.
But they really are insured, because when they go to the hospital, they're not going to be turned away. So just because they don't have insurance doesn't mean they don't have health care.
They'll go to University Health and we'll fix them, and you and I will pay.
That's the point. It's not health care. It's welfare. And until we start to deal with it like that, what did I say to you earlier this week? Wouldn't it be great if Erin could sit down and when it's time to pay for her insurance, she could pick and choose exactly what she wants?
Yes.
You have maternity care. Pardon me, you're a 50-plus-year-old woman.
I don't need it.
I think your childbearing days are over.
I don't need any prostate care either.
I don't need birth control.
No.
The point being, you are paying for people who don't. I am paying for people who don't. And when McCain and Murkowski and Collins all vote for the status quo, which is in effect what they did yesterday.
Yeah.
When they decide things are good the way they are voting to continue the current system of welfare and entitlement. When you see Bernie Sanders up there in front of those folks yesterday, giddy because Obamacare will remain, and you see the people holding the signs, "Don't take away my health care." The part of that sign that is missing is, "Don't take away my health care that someone else is paying for."